Holiday Travel 2020 edition. Normally at this time of year, we offer safe travel tips that focus on weather, safe driving techniques, security when using public conveyances, and maintaining healthy dietary habits while celebrating. All of these precautions are just as salient as ever, but 2020 is different. The COVID-19 pandemic has added a level of risk to our holiday celebrations, which is unprecedented in most of our lifetimes. Consider the information on the following pages if you're thinking about travel. A recent study for the Department of Defense indicated that HEPA-filtered ventilation systems on typical wide-body aircraft would effectively control airborne transmission of infectious particles. Air is introduced overhead and collected near the floor. The exchange rate is 15 times higher than a typical residence and 5 times better than the recommended design specifications for operating rooms. The supply air is 75% fresh outdoor air. From a COVID-19 standpoint, sounds good, but there are other considerations. There are several possible transmission modes that were not accounted for in the study. Surface contamination. Is the plane powered and filtering air at the gate? And human behaviors. Ventilation can't prevent being coughed on or sneezed on by a nearby person. Mask use is likely lower in common spaces such as lavatories. The study did not consider the terminal, including security lines. Driving with only members of your own household may be a better option, as long as precautions are taken during stops along the road. We plan on hosting Thanksgiving dinner. Our extended family members have agreed not to come if they feel sick. We know they are being as cautious as we are. The risk is low. Or is it? How your guests feel just before traveling or on the day of the event is only one consideration. The CDC also recommends that invitees also not attend if they or any in their household has been diagnosed with COVID-19 and they have not yet met the criteria for release from isolation, or have been exposed to someone with COVID-19 in the last 14 days, or is at increased risk of severe illness from COVID-19. Okay, how about if we ask everyone to get tested before they come? No test is perfect. A test may be negative early in the infection and for asymptomatic people who may still be able to infect others. A test represents one point in time and does not indicate an individual's status outside the moment the specimen was collected. Reliance on testing alone to prevent transmission will be ineffective without the use of additional strategies such as mask wearing and physical distancing. What other things should we and our guests consider before agreeing to attend the gathering? Things to think about include, what are the current infection rates at starting locations and destination? Can the gathering be held outdoors? How long will it last? How many people will attend? What behaviors will attendees practice in the time leading up to the gathering? Will they self-quarantine as much as possible for the week or two before the event? Will they wear masks in public and practice hand hygiene? Will they be adhering to social distancing practices? What we recommend instead is this. With the growing infection rates throughout the country, consider these options. Limit your celebration attendance to members of your own household. You could hold a virtual gathering, plan a meal that everyone can prepare, and set a dinner time convenient to everyone to eat and engage in a video chat. If that doesn't work due to time zones or other difficulties, make sure to schedule video chats at a time convenient to your loved ones. Prepare traditional family recipes for relatives and neighbors, especially those at higher risk of severe illness from COVID-19, and deliver them in a way that prevents close contact with others. Okay, we've talked about all that. We think we have it covered. We're really looking forward to getting together. It's been so long. Any other words of advice, Doc? Well, if you still decide to go ahead, then certainly there are things you can consider to help reduce the risk at the celebration and afterward. Things like have one person serve rather than having a buffet line or passing bowls and utensils. Maintain distances as much as possible. Waves and smiles may not be as comforting as hugs and kisses, but consider the circumstances. It may be uncomfortable, but mask wearing while not eating may help to lower risk. Keep the windows open as much as possible. Have hand sanitizer readily available. Wash hands and be sure to disinfect surfaces before and after the gathering. Self-quarantine as much as possible for a couple of weeks after. If you feel sick or test positive within 2 weeks after the event, immediately contact the other attendees and let them know. If someone at the gathering contacts you with this information, stay home for 14 days and monitor for symptoms. If you do decide to travel, travel wisely. From the ECC family to yours, have a safe and healthy holiday season.